I think it's important for folks who have celiac disease or who are following a gluten-free diet to be able to really look at all the information out there, do your Google searching and stuff, because folks like bloggers like myself and other writers and other very reputable sites will help you disseminate this kind of information to understand if this is a good purchase, if this is real, or is it too good to be true.
And certainly we've been reporting on the programme for the past few weeks about at least 2 human trials that we know of, which are ongoing at the moment, for some kind of treatment for celiac disease in about a year or 2. What do you reckon to that? Was that discussed at all?
Yeah, they did talk about several trials. There were a couple of different organizations that are there. Some are working more on a vaccine. Some are working more on a better enzyme that would really break down that gluten in the body if you happen to get it. It is not like a lactate or something that would prevent any kind of damage to your intestines if you decided to eat an entire gluten-filled meal, but it would be something that would definitely assist you if you were traveling and something accidentally happened, if you accidentally had cross-contamination, maybe during a family meal or something like that. And they are working on trying to really get that kind of an enzyme in place and ready for folks.
So you mentioned that one of your favourite sessions, one which was outstanding for you, was the one about the myths, the fallacies rather than the facts. Let's discuss a few more of those, because I know some people can get particularly worried about things like, well, lipstick and shampoo, can't they?
Right. So lipstick in particular, that is something that you need to make sure is gluten-free, because we ladies absorb lip balm, lipstick, anything we're putting on our lips will eventually, for the most part, be ingested. And so those kinds of things need to make sure those are gluten-free. But this dermatologist who spoke, he had said that even shampoos cannot, if there's gluten in shampoo, he says it cannot get through the hair follicles. That saran wrap-ish kind of layer that he described also takes effect up in the scalp. So unless you have a cut, some kind of lesion or something, an open wound on your skin, he says gluten cannot get into the skin and then cause a reaction.
And one of the other speakers, I know, I think probably on another debate, on another session, caught in a little bit of controversy, didn't they? I think from following the tweets, and it's difficult to follow exactly what's going on at a conference in 140 characters, but there seemed to be a swell of opinion that he had spoken out of turn. What he seemed to be saying was, don't worry too much about cross-contamination. Were you in on that session? What was the reality? Yes. What actually happened?
So in that session, if we're talking about the same one expert, and I don't have his name in front of me, I apologize. He had said, I'm not sure what country he was from. He was not from the United States, but he had said not to worry too much about trace bits of gluten. That was his phrase, was a trace, was the word he was using. There was some uproar on Twitter when that was out there. I don't know that he ever really did a fantastic job at really clarifying what he meant, because I think he needed to explain to folks what trace meant. Did he mean don't worry about potentially getting an accidental crumb of gluten from the counter when you're making your breakfast? Or did he mean a trace being half a slice of pizza that has gluten in it? I never really quite got that response. I didn't personally necessarily feel like he meant go cheat. I didn't feel like he meant that. But sometimes as you may know, in Twitter, in email, you try to convey something that's happening and it might not come out just right or whatever. But people in the session did question him about it, even afterwards, because we had a question and answer session, and he was trying to explain it a little bit better, but still never quite got that visual of what exactly do you mean by a trace. So that may have been a little bit lost in translation because I'm not sure if I don't think English was his first language, so there may have been a little confusion there.
Okay, yeah. I mean, seeing various tweets on that, I mean, I would agree with you. Obviously, I wasn't there, but from my perspective, it seemed to be, you know what, if you worry so much about the odd crumb here and there, actually worry can actually affect you and your life and your health and well-being more than the actual crumb would in the first place. That was my kind of understanding. But.
Agreed. I would agree with you there.
Okay. You mentioned, Amy, about the Q&A sessions. I mean, that sounds really good, that people were, as well as presenting sessions and having those on-stage discussions, were able to open the floor for people to ask questions. So, with respect to your fellow attendees, your fellow delegates and bloggers and journalists there, were they really intelligent questions? Were they taking the debate a little bit further forward, or were you kind of slapping your head and thinking, oh no, surely that's Celiac 101, you should know that before you came here?
Well, first of all, I was so pleased to see how many experts were willing to go the extra mile and talk to lay people about the questions they had regarding celiac. Sometimes they were during those Q&A sessions. Sometimes they were out in the entryway leading into the conference room. So they were just, these are the top researchers, and they stopped to talk to, Joe Schmo, who's there because their daughter has celiac, and he wants to ask a question. So it was really great in that respect. But some of those questions and answers that happened like post-session, and that happened relatively formally with 3 microphones in the room. The panel was still up at the front of the room, and so they still had their mics and everything. So it was a little bit more formal than, speaking out in the entryway. Some people would ask questions very related to the subject matter at hand and would get clarification. Maybe they didn't go into a lot of depth, and this person just wanted to take it one more step forward with another question. But sometimes people would just sort of ask whatever the question was that was on their mind. There was one lady who promoted her book. She insulted the panel and then asked a question hoping she would get some answer. And I'm thinking, I don't know that happened in the right order. And then there was another lady who was trying to find out from a pediatric expert if she really needed to bring her celiac child or her potential celiac child into the doctor's office for diagnosis. And the doctor looked at her saying, I need to see your kid. I need to see the patient. You can't come in and talk to me like you're the child. I need to see the child. But the mom kept asking, but they're 4. And, it's so difficult to, get them from daycare and then bring them down and, all that stuff. And the doctor looked at her and said, I need to see the patient. So so it did run the gamut. And then there were doctors there who were asking very specific questions about, what they're seeing in their practice. So it ran the gamut from lay people who are trying to live with this disease and manage it to doctors who are trying to learn more to make sure they have enough information for their patients.
So a real cross-section of people. And it went on for 4 days in Chicago. So how many people were around? I mean, how many delegates were there?
There were about 800 or so people signed up for it. And that could include, I believe that included the speakers and the attendees. But both sessions, simultaneously, they were kind of putting on 2 conferences. They had one session, which was a clinical forum, and that's the one I went to and that most lay people would have gone to, but there were a lot of practitioners there. And then there was a scientific forum, and I think that was much more research and for researchers and people who really were getting into the nitty-gritty technical discussion. But they were happening at the same time in 2 separate ballrooms on the same floor. So the experts would pop in and out. They'd go back and forth in between the 2 sessions. So you really were getting the best of the best.
So it was kind of double your money, as it were. You were getting an awful lot of information there if you could swap between the 2 sessions, I guess. And also, I would presume that there were lots of other things on offer, as well as, meeting other people perhaps in a similar situation and just swapping stories and experiences and contacts yourself. But books and products and stalls and people giving out leaflets and brochures, that kind of thing?
It was so well organized. You know, I walked in, got my all my handouts, and they had several packets of information. One that was simply on restaurants nearby in Chicago that offered gluten-free options. So you knew where to go to eat, you know, after the conference. And then, of course, they had great gluten-free meals during the conference. And then there was another handout that had brochures from all these different supporting companies, some of which I believe were there in their marketplace area, which was an expo vendor kind of an area, showing off all their stuff. And then some that I think were more supporters, wanted to get their word out about their products. And you could go through that and look at every single one and learn more about each company. So there were definitely those kind of relationships that you were able to work with, and certainly learn about some cutting edge either research, because some of those vaccine pharmaceutical companies were there, as well as some food product companies were also there. And then, of course, yes, you absolutely could have met people, as you know, as a mom like me with a daughter who has celiac disease. I met several other women who either had celiac disease or their daughters and sons had celiac disease, and they were just trying to get more information and really appreciated some of the information that they were able to get. Some of it may have been a little over their heads, but like that celiac myth one was really a good session. And then the last day on Friday, there was one that was a little bit more extensive. I forget the title of it, but some of the top experts were talking about kids, incorporating the gluten-free diet with your kids, and then even trying to get the gluten-free diet at your child's school and at college. Here in the United States, it is somewhat difficult still. And so there was a mini session on that within a bigger session on the last day.
Okay, let's round off with a couple of final questions then. What will you, Amy, be doing differently as a result of going to this particular conference?
The one sentence that I walked away with that was just so important to me, or just stuck with me, was silent symptoms are silent until they're not. And he described that like osteoporosis, infertility, liver disease. You don't know that these symptoms are there until suddenly they're just so far gone that it's really a troublesome problem. And so that was just something that so I think that's something I'm going to always keep in the back of my mind, just about silent celiac and how sometimes it's happening and we don't know. And it's really important, if you are a first-degree relative, to go get your blood tested. At the very least, go get the serology testing, celiac panel, to just get a baseline to see where you're at, because you don't want to have silent celiac. If you're asymptomatic, you don't want to go for years and have all this damage, and then maybe perhaps it could end up being something that you can't fix later.
Now, the next conference is not for a couple of years. It's a little bit less convenient for you guys in the United States, isn't it? It's Eastern Europe, isn't it?
Correct. The next 3 symposiums they have all plotted out. So 2015 is in Prague, 2017 is in New Delhi, India, and 2019 they voted to have in Paris.
So the next one and the next one but one, really convenient for us. Well, I tell you what, when you come over, I'm sure you'll be over for the Paris one. Make sure you visit make sure you visit London, England as well. Amy, thanks so much for joining us. Let's not let you go without you saying where people can read your write-ups of the symposium and how they can follow you on Twitter.
Oh, absolutely. So you can follow me on Twitter at Amy Leger, and it's AMYLEGER. And I write for my website, which is called thesavvyceliac.com. And I write about all kinds of different things. I do have also a book out there that I recently published, an ebook called The First 30 Days Gluten-Free. So if you are newly diagnosed, this is something that will give you a quick read crash course on how to go gluten-free and not feel so overwhelmed right away.
That sounds really good. And just to remind people that, of course, the Savvy Celiac spelled without that pesky O that we insist on putting in over here.
You are correct. Thank you.